Our first presentation of the afternoon is Dr. Mary Scollay, who's the Equine Medical Director for the Kentucky Horse Racing Commission. She has been quite a force in these summits. As we said earlier, the equine injury database was to a large extent her brainchild, and she's going to, I got my signals crossed up, she's going to give a presentation and then ask you all to step outside and she will give a demonstration. So I hope the only misinformation you get today, I'm sorry it came from me, but anyway. Dr. Scollay, one of the subjects that's very near and dear to her is the importance of pre-race exams, and she's going to talk about that. Dr. Mary Scollay.
Oh, I need Chris's box. Thank you all. Appreciate the opportunity to visit with you today, and I'll do my best as your first speaker after lunch to keep the eyelids up. So I'm going to talk about the pre-race exam. It's very important to me, and I think it's a valuable asset to the industry, so I'm going to talk to you about that just a little bit. And first of all, what's the goal of the pre-race exam? And I think it's pretty simple. It's to effect the withdrawal of horses that are unsound or unfit to race or have an unacceptable risk of injury. And I think the emphasis there needs to be unacceptable. It's important to recognize that there is no such thing as a life without risk. You all assumed a certain level of risk getting in your cars and coming over here today. So we are not attempting to eliminate all risk. We are trying to understand the risk that exists and determine whether or not it is acceptable for a given situation. So the success of the pre-race exam program, to my mind, is reflected in the exams that don't take place. I think that if we are clear in establishing our expectations with regards to a horse's soundness, the trainer is then able to recognize that his horse's condition is not going to be acceptable, and then he can determine not to enter the horse, or if the horse's condition has changed after entry, he can make the decision to withdraw the horse. I think that if our vets are recommending a large number of scratches, that we may have failed to adequately educate stakeholders with regards to our expectations with regards to a horse's condition on race day. So the pre-race exam, I'm going to go through it briefly, and then Bryce Peckham will demonstrate it for you on, back there. We confirm the horse's identity by tattoo or microchip. We do a general assessment of the horse's condition and its demeanor, preferably before we actually contact the horse. We then palpate and manipulate the forelegs, the forelimbs, and we observe the horse in hand at the trot, going away from us and back towards us, and we may perform an additional evaluation as warranted by the findings based on that initial exam. So the question is, has the pre-race exam been effective? And I think you may get a mixed opinion on that, although I'm a strong supporter of it. In an article in the Journal of the American Veterinary Medical Association in 2000, a study that was done here in Kentucky, 3.7% of horses that were examined were assessed to be at increased risk of injury based on the findings of those physical exams. Of that 3%, 1.6% were observed to be lame on track during or immediately following the race. So to that end, it would appear that maybe the pre-race exam is not particularly efficient in identifying the horse at risk. I think there are a few caveats that need to go along with presenting you this study. And the first one is that none of these horses were observed after they left the racetrack, so we don't know if they cooled out poorly. It was not evaluated the interval to return to race of the horses that were determined to be at increased risk, so perhaps there was a delay in their return to racing. That's a question we don't have the answer to. And I think it's also important to remember that this study was performed at a time when medication regulations were considerably more liberal in Kentucky and the administration of NSAIDs on race day was permitted. So it's possible that an injury would not clinically manifest until sometime after the horse had exited the racetrack. So although this suggests perhaps the pre-race exam is not effective, I think there are also questions as to the validity of some of the conclusions here. So let's talk about my experience with the pre-race exam, and so I'm referring to data that I collected over a 10-year period in Florida when I was working at both Calder Racecourse and Gulfstream Park, both of which you know conduct flat thoroughbred racing, and it's a year-round circuit between the two racetracks. So between 2000 and 2010, we had approximately 160,000 starts at Calder, and during the same period at Gulfstream, we had 77,000 starts. We had a substantial number of race starts during that 10-year period. So what I did was take 407 horses that had been scratched. Those scratches were initiated by the regulatory veterinarians based on a determination that the horse was unsound. So they included the pre-race exam, post-parade scratches, a horse warmed up lame, or gait scratches for unsoundness. They did not include trainer-initiated scratches. They did not include scratches for conditions unassociated with lameness. So if a horse was scratched for colic or having got cast in its stall, those horses were not included in this. And we did not include gait scratches where the horse sustained trauma after being fractious in the gait. So the 407 horses represented horses that were observed to be lame. The controls were then 814 horses, so 2 controls for each case horse, and those horses were randomly selected out of the horses that started in what I called target races, and those are races in which a horse was scratched out of. So a case horse came out of that race, we got 2 controls out of that race, and those were horses, the controls were horses that crossed the finish wire. That was the only requirement for them to be included. So we didn't assess their performance, we didn't try and determine if that horse had been lame following the race. We just looked at horses that started and completed that race, and those were our controls. So the case horses, 88 out of 407, or 21.5% of the horses that were scratched, did not start in a race after the date of the scratch. And when I first saw that, I thought that was a pretty high number. And then last month at the ICRAV meeting, Brian Stewart, who is with Racing Victoria in Australia, presented similar data, and 29% of the horses that were scratched in Australia failed to make another start in their career. So I'm feeling a little bit more confident about the number, the 21.5%, and I think that's a pretty substantial number. Compare that to the controls, where 24 out of 814 did not start in a race after competing in a target race. I have to mention that a statistical analysis was not performed here. What you're seeing is math, and I need to say that because Tim's in the audience, and I am very aware of statistical significance, so I'm going to defer to him on that, but I still think that this is worth noting. So let's look at those 407 horses, case horses that did start again. 319 of them, or 78.4%, made a race start after the date of the scratch. 319 of the 407 case horses made a race start after the date of the scratch. The mean interval for those horses that did make a start was 109.8 days. 6% of the horses that did make a start did not make a race start in the 12 months after the scratch. Compare that to the controls. Okay, 97.1% of the horses made a race start after competing in a target race. Their mean interval from target race to next start was 38.5 days. Again, a noteworthy, if not statistically significant difference. 8 of the 790 horses did not make a start in the 12 months following their target race. Narrowing it down even further, of the 319 case horses that did make another career start, 92.8% of them raced within 12 months of the scratch, and their mean interval from scratch to next race was 82.7 days. Comparing that to the controls, 99% made a race start within 12 months of the target race, and their mean interval from target race to next start was 34.2 days. (77.4% of the case horses made their next start within 6 months of the scratch. Their mean interval was 52.3 days. Controls, 97% made a race start within 6 months of the target race. Their mean interval from target race to next start was 30 days. And I suspect that if we spoke to many trainers, they would say that the 30-day interval is a reasonable interval to expect between races for horses that are healthy and in active training. So it looks to me like scratch recommendations do reflect a reasonably accurate ability to identify physically compromised horses that should not compete. However, to me, the high percentage of non-starters post-scratch suggests that in some cases intervention might be occurring too late. It's not our goal to bar horses from racing. It's our goal to identify horses that should not race such that they are given an opportunity to recover and return to competition. So I'm disappointed by the 21%, but it appears to be a real number when looking at that which has occurred in Australia. And given the occurrence of racing injury and the lesions that we observe on necropsy, it's also pretty clear to me that we are missing horses for which regulatory intervention is appropriate. For me, there is a catch-22, and that catch-22 is that we've drawn a pretty clear line in the sand with respect to our expectations for a horse's clinical presentation on race day. Oh, my line in the sand has moved. How about that? The problem with that clear line in the sand is that I believe a marginal horse's clinical presentation can be manipulated to satisfy pre-race exam requirements when in fact the horse's condition is not consistent with safe participation in a race. So to me, the appearance of soundness should not necessarily be equated with musculoskeletal health. And for me, the problem with the race day exam is the risk of the illusion of soundness. My personal feeling is if a horse is sound, he should look fine no matter when you look at him. But if he's not sound, if he's marginal, if he's got musculoskeletal compromise, the more often you look at him, the more likely you are to accurately understand his condition and respond appropriately. So what we've done in Kentucky is we have tried to expand our pre-race exam protocol, and what we are doing now is identifying what we call horses of interest, and we identify those horses based on a number of criteria. Exercise history, working very hard to get my veterinarians to become students of the past performance. It is, in fact, a biography of the horse, and it gives an awful lot of information to the seasoned eye. So we're trying very hard to get them to spend more time looking at past performances and identifying questions that should be asked based on the information there. We look at our pre-race exam findings over time to note any changes. We review race replays. Historically, we had reviewed race replays when horses were catastrophically injured. We're now trying to expand that to include regular races so that we can identify a horse that finishes the race but perhaps was not traveling particularly well in the latter portions of the race and is a horse that we want to follow up on. We're trying to expand our post-race observations, looking at horses cooling out after a race. We may be assessing horses on days other than those that they're scheduled to race. We're looking at drug testing intelligence, and we're looking at security intelligence, information that we receive from stakeholders. So the exercise history, some of the criteria that we look at that raise our interest level, horses that are making their first time start after June of their 3-year-old year, that raises a question for us. Doesn't mean the horse is unsound, but it raises a question, and we like to get the answer to that. If a horse is showing a substantial drop in class, if he's making his first, or more importantly, his second start after a layoff of 60 or more days, we have found in looking at our injury population that the horses appear to be more likely to be injured in their second start off of a layoff than their first, so we have adjusted our evaluation protocol accordingly. Rider changes, I think, can be very informative. Multiple riders over a period of time, or the change from a journeyman to an apprentice, particularly in the case of a horse that doesn't show speed, a horse that has to be tactically ridden. That raises an eyebrow for us. And deviations from known trainer patterns. So the pre-race exam, we're looking for changes in finding. A negative change, but equally interesting to us is a positive change, improvement that is inconsistent with an interval of rest between the current race or the race at hand and the previous race. The review of race videos, I've already mentioned that. Post-race observation, random assessment of horses as they cool out, or also earned observation. If a horse was eased, if a horse threw his head up at the top of the stretch and did not finish his race, that would be considered earned observation. And so we're trying to get a better look at those horses over a longer period of time. Out of competition assessments after entry but before race day. Between races, and this to me has become really interesting. Some of these examinations are regulatory veterinarian initiated. We had a question about the horse and we want to follow up before we see the horse enter again. But I think we've also been effective in notifying trainers that we are interested in seeing horses of interest before they're entered. So within the last week, we've been contacted by 3 different trainers who said, look, you may not be really happy with how this horse goes on race day, so I'd rather we answer the question before we enter him. You can come out and watch him breeze, do whatever you want, but let's see if we can reach agreement on whether or not this horse should participate before I put him in the entry box. So I view that as a huge step forward in protecting the horse and working effectively with the horsemen so that we do understand the condition of these horses. We also hope to expand our observation of the horses to having somebody trackside during training hours observing the general population. I think there's a fair bit of intelligence that can be garnered there. Drug testing results, we have the ability to see what we refer to as filters off results. After the drug testing is finalized, I am able then to see a report generated by the lab that shows me all of the substances that were detected in a post-race sample. And so the first thing I'll tell you is that all of these samples that you see here are in compliance with our regulations. Nobody broke a rule here, and the non-steroidal anti-inflammatory medications that you see here, I don't believe had any influence on the horse's condition at the time of the race. That's not what we're talking about. What we're talking about here is we're seeing in this set of samples 4 horses that had more than 2 NSAIDs on board. Very low concentrations, but they're there nonetheless. So that tells me that somebody believed that horse needed that medication. And that tells me I want to know more about that horse. So once the drug testing has been finalized and the final report has been issued by the laboratory, I get to see this, and if I need to identify those horses and notify my veterinarians that those are horses of interest, that their soundness is something we want to assess more thoroughly, we're able to do it. So to me, because we have a lot of horses to look at, it's really important to get the right horse on the radar screen, and I think when we do that, that improves everybody's decision making. So I thank you, and if there aren't any questions, we're ready to come on back, and anybody who hasn't seen a pre-race exam is welcome to come on back and see. If you have and you want to snooze for a few minutes, that's okay too. Okay, so we're going to have a go at this. Our volunteer horse belongs to one of the outriders, so he's supposed to be very calm. But today he's not so sure, so if we could ask you to kind of, a little bit of this would be helpful. The gentleman in the lavender shirt is Dr. Bryce Peckham. He is our chief racing veterinarian, and he's going to go through the pre-race exam, and I'm going to discuss it as he goes ahead. So the first thing we do is we have the horse's attendant display the horse's lip tattoo to us. The reason that we don't contact the horse's nose is for infection control processes. We're going to be contacting perhaps up to 100 horses in a given day, and if there's a virus in the barn, we don't want to be transferring it from one horse to another. The next thing that we do before we substantially interact with the horse is just do a general assessment. We are interested in body condition score. If a horse is too thin, we're going to address that. And then we're going to start interacting with the horse. If we get the chance to look at the horse before the shanks on the horse, we will assess its demeanor in the stall, see how it's standing when no one is interacting with it. Oftentimes we don't have that opportunity because particularly Keeneland, the grooms are ready for us. So we start right in with the exam. And that involves the palpation and passive manipulation of the forelimbs, meaning the front legs. We are checking for things like range of motion or diminished range of motion. We're checking for joint effusion or fill in a tendon sheath. What we're looking for are indications of active inflammation, and the 4 cardinal signs of inflammation are heat, redness, pain, and swelling. Redness we are unlikely to detect on these guys, but heat, pain, and swelling certainly we can. Now we won't look at a horse on race day if it's been standing in an ice tub or if the horse has had cold water bandages on, because that diminishes our ability to detect heat. So if we happen to come to a barn and the grooms were unfamiliar with our procedure and the horse was in an ice tub, we'll have them take the horse out and we will come back an hour or so later to look at the horse after the limbs temperatures have returned to normal. You'll notice that Bryce is looking at the horse on both sides. A lot of grooms will pick out both feet from the left side of the horse. They get used to doing a lot of the work from one side. We like to be sure that we see the horse on both sides. A lot of times a tendon profile may not be appreciated from one side, but when you get to the other side, you're able to see it. So we try to really look at the horse in all three dimensions. Once we've palpated and flexed the limbs, and we're then going to have the horse jogged in hand away from us and back towards us. And we'll see if he can be a good pony. Now, Kathy's doing a really good job of keeping the horse on a long, loose shank while she's jogging it, because head movement is really critical to our ability to assess lameness. And sometimes part of the pre-race exam involves training the handler as to how to present the horse to us so that we can get an accurate assessment. For some older horses that perhaps move a little crabby, such as I do when I first roll out of bed in the morning, if we have questions about that horse's movement, we will give the groom the opportunity to walk the horse around the shed row a couple of spins, give him a chance to loosen up, and then take another look. If we have a question about a horse's gait, whether there's a lameness or just an idiosyncrasy that is not indicative of pain, we'll bring our veterinary team together and have a minimum of 2 people look at the horse together. So if there's any question about a horse's condition, we're going to achieve consensus as to whether or not we scratch or let the horse compete. So the bringing together the team, I think, is really important when a decision is not necessarily obvious. Thank you, Kathy. Thank you, Stacy's pony. Dr. Peckham, job well done. You're hired. Does anybody have any questions? Yes. Dr. Broken, I'm looking forward to this. Typically, we're going to record those findings. If we're satisfied with how the horse travels, we'll put a watch on that horse and make sure that we give it special attention the post-parade with the weight up. And again, we'll watch it turn at the jog and do some more sort of finesse maneuvers than we see in just the going away and coming back. If there's lameness, if there is resistance to flexion, if the horse is painful on flexion, those are things that are going to get us to be more aggressive in our exam before we proceed, before we authorize the horse to go up for the post-parade. In some cases, as you know, we'll involve the practicing veterinarian. Come take a look at this. Or perhaps we'll say, you know, this horse is off right front. We have no history of that. Do you want to come take a look and see if there's a nail that needs to be pulled, if it's something that can be remedied in compliance with the rules? So. Right, and that's where the historical exam helps you, and I think it's also important to point out that the last perfect horse I saw was like when I was 12 years old, and at that point I thought they were all perfect. So we have to recognize that there are flaws and even evidence of previous injury that are consistent with safe and successful racing performance. So we are, we are not looking to just exclude anybody that is short of perfection. We've got, I think, a realistic expectation of form and function and an understanding of musculoskeletal conditions that are and are not consistent with safe participation in a race. We typically do not. Part of that is sort of, if you will, an actuarial event that the majority of 90% of our catastrophic injuries occur in the forelimbs. We very rarely see serious injuries to the hind limb. And most of our hind limb issues, we're going to observe when the horse is in motion. That's where we get our best assessment of issues with the hind limb. Thank you all. Back we go. We normally start in the shed row if we have a question, because I think that in many cases is more consistent with the surface that they're going to be racing on. But if we have a question, let's go out to a nice flat level. And some trainers have a preference. Some of them would prefer to go outside on the hard ground, and we certainly don't have a beef with that.